The pulse in the room was just electric. It was so exciting watching all of those yeses roll in.
Major developments today at 3 Portland hospitals. More than 2,000 nurses at Legacy Emanuel, Randall Children's Hospital, and Good Samaritan Hospital voted to join the Oregon Nurses Association labor union. They're calling this an unprecedented show of solidarity and a historic victory. This week's vote received near unanimous support from nurses at all 3 hospitals. This means nurses there will create bargaining teams and start negotiating their first union contracts as part of ONA. Here's what some of them told me today.
This is so exciting. We have been working for decades to have this happen.
This is going to lead to nurses who have more and better resources to take care of their patients. The community is going to feel that.
I think it's great to have protection and to have a voice at the table. I think having such an overwhelming support show up to vote yes just shows how excited people are.
A spokesperson from Legacy Health sent us the following statement, reading in part, quote, "Legacy Health respects the rights of our employees to choose whether or not to be represented by a union, and we are committed to establishing a productive dialogue with the union representatives that will be working with Legacy on behalf of our employees." Now, this move to unionize comes as a merger between Legacy Health and OHSU is on the horizon, with the nurses telling me that there are a lot of unknowns with the merger, calling it uncharted territory. This also comes as nearly 5,000 healthcare workers at 8 Providence hospitals have been on the picket lines for nearly a month, marking the largest healthcare worker strike in state history. And in just the last hour, we learned that strike will continue. A tentative agreement was reached late Wednesday night, and union members voted over the past day and a half on whether or not to accept it. But 83% of those who voted said no. Some hospitalists at Providence St. Vincent have until tomorrow afternoon to vote on their own tentative contracts. But for nurses in the Portland area, the strike goes on. Providence said late this evening they're disappointed that nurses didn't agree to the deal. Now, I asked Legacy nurses today if they foresee a strike on the horizon and what their top concerns are. And no surprise, it comes down to higher wages and safe staffing.
We're focused on starting a contract, and I have a really good relationship with Legacy and Randall leadership, and I have tons of respect for them, so I'm hopeful that we can, bargain on a good contract in good faith.
They recently passed a bill here in Oregon for safe staffing, and it's been a challenge having the staffing actually meet what the law says. So a lot of nurses are going without breaks because there's just no one to send them on a break.
How hard is that?
It's really tough. It's a 12-hour shift, and if you don't have time to go replenish yourself, get a snack, just take a break, it gets really tiring.
Now, time will tell if the Legacy nurse unionization will have an impact on patient care through a strike or something else. We'll keep you posted.